This is the NCN 6 o'clock news, and in some news just in, the People's Progressive Party says possible financing of the Alliance for Change's electoral and political activities through the proceeds of narco trafficking and drug money flies in the face of the holier-than-thou image that the AFC has cultivated. The PPP says it has noted the reactions of the Alliance for Change to the public disclosures by President Barrow Jagdeo at the Babu John activity last Sunday. A release from the PPP states that the AFC's immediate response suggests panic. The disclosures dealt with questions about the source of AFC financing of their electoral and political activities and included information about its linkages with persons implicated in the recent seizure of cocaine concealed in pepper sauce in Canada. The PPP insists that the AFC was also chided for misrepresentation of facts, sensationalization of issues and engagement in double standards. The PPP says it urges Guyanese to reject utterly the machinations of the AFC and calls on the authorities to follow upon these disclosures. Well, government has proposed to offer eye treatment to Surinamese patients free of cost. President Barrow Jagdeo indicated that he made the offer to the Surinamese president during a recent visit. Details from Unika Jones.
The new ophthalmology center at Port Morant has the capacity to conduct about 200 eye operations daily. The facility, which is the first of its kind in the Caribbean, will be initially manned by a team of Cuban doctors who will be replaced by Guyanese studying in Cuba.
While these people will stay at Port Morant for 5 years or a few years beyond that to allow Guyana to prepare the specialists and the general doctors to replace them, there is an undertaking by the Cuban government to extend that 5-year stay to as long as is possible. That is the Cuban presence as a whole, but individual doctors are expected to stay in Guyana for at least 2 years.
During a recent cabinet outreach in Berbice, President Barrow Jagdeo inspected the facility. There he announced that he proposed to the Surinamese president that those patients with eye ailments from that country can receive treatment free of cost here. The facility was constructed following an agreement between President Jagdeo and former Cuban President Fidel Castro. The agreement also included the construction of 4 diagnostic and treatment centers at Diamond and Mahaicony in Region 4, Leonora in Region 3, and Suddy in Region 2. The ophthalmology center is expected to improve the eye care program in Guyana while reducing the need for Guyanese to travel to Cuba for eye treatment. Services offered at the center include eye screening, corrective refractive error, cataract, and retina detachment. Onika Jones, the 6 o'clock news.
The National Blood Transfusion Unit says it is experiencing a severe shortage of blood of all types. The Blood Transfusion Service indicated that the shortage could affect several persons who are to undergo open heart surgeries on March 7. Persons desirous of donating blood can visit the National Blood Transfusion Service in Georgetown, the New Amsterdam Hospital, the West Demerara Regional Hospital, and the Suddy Hospital on the Essequibo Coast. General Secretary of the Guyana Rice Producers Association, Dam Kumar Siraj, has condemned news items carried in the Kaichor newspaper and the Prime News regarding issues raised by an action group purported to be part of the organization. Mr. Siraj has also expressed surprise at being quoted by the Kaichor newspaper since he said he did not conduct any interview. He says the RPA is run by a general counsel, noting that only General Secretary can make statements or authorize staff to speak on the organization's behalf. He points out that the Jinnah Rahman, who is said to be the spokesperson of the group, is not a rice miller and has no affiliation with the RPA. Mr. Siraj notes that while he is dissatisfied with paddy prices offered to farmers, global economic troubles and negative growth effects most to be taken into consideration.
Well, the Ministry of Transport and Hydraulics will be hosting an engineering conference under the theme Optimizing Performance and Practices. Tomorrow, Transport and Hydraulics Minister Robson Ben says all ministry and private sector engineers are invited to attend this event. Details from Nicole Telford.
How do we optimize, how do we improve our engineering practices to have greater sustainability, for one, and two, ways in which we can have savings in terms of our engineering practices, the use of materials, and overall how best we could have cooperation between the various engineering groups.
Transport and Hydraulics Minister Robeson Ben. The conference is scheduled for March 5 and 6 at the International Conference Center at Lilliandale.
Persons from the University of Guyana, private firms, engineering, contracting or consulting firms, and all others who have interest in these matters would be invited and are welcome to come to these sessions.
Minister Ben adds that the conference is intended to address and resolve issues that are pivotal to the field. He believes that the engineers can only improve the services that they provide by the commitment and proper implementation of projects. Nicole Telford, NCN, 6 o'clock News.
The police have arrested 3 persons for the murder of 77-year-old George Cadogan of Lot 108 Cemetery Palm Road, Durban Backlands. Relatives say the police have arrested 2 carpenters and the cook. On Thursday, Cadogan was found gagged and bound in his middle room of his 2-story Durban Backlands home. It is reported that the man's laptop, television and 2 cellular phones were missing while his stereo set was left in the doorway. Sources say that the bandits gained entry through a window in the lower flat since carpenters prior to the incident had taken out the grills to do painting. Cadogan, who suffered from a stroke, only returned home during the Christmas season to avoid cold weather. The Ministry of Health has expanded its vaccination program with the introduction of retrovirus vaccine, which will reduce diarrhea among children. Health Minister Dr. Leslie Ramsamy has disclosed that diarrhea is a significant cause of infant mortality in Guyana. Details from Monica Jones.
Each year, more than 5,000 children die from diarrheal diseases caused by rotavirus, while another 2 million are hospitalized. And according to the World Health Organization, most deaths occur in developing countries where access to the treatment is limited. However, Guyana's Health Ministry has managed to secure the rotavirus vaccine to protect all children.
So now the children will be immunized against rotavirus, and so we should have now approximately 25 to 40% reduction of children with diarrhea. This will further reduce infant mortality in our country.
The ministry is working towards 100% vaccination coverage. The health minister is therefore calling on churches and the non-governmental organizations to assist in ensuring all children receive the required vaccines.
The fact that we don't have 100% coverage has nothing to do with the government's inability to procure enough vaccine. We have enough vaccine to cover all of our children. But the fact that there are a very small number of children who do not get their vaccine has more to do with the fact that their parents have not brought them in.
The rotavirus vaccination started here last year, but only on a small number of children due to the high cost. The program is a partnership with the World Health Organization and the U.S. Centers for Disease Control. It was established in 2003 with funding from the Gavi Alliance to make the vaccine accessible to children worldwide. Onika Jones, This is Clock News.
2 persons have been injured following an accident on Dennis Street in the vicinity of Ayfield, Sophia. Reports are that around 17:10 hours, a speeding Route 48 minibus tried to overtake a pickup vehicle. The minibus subsequently slammed into the pickup before losing control, hitting a bread stand and plunging into a nearby trench.